About a patient that I've been seeing, treating, managing for the last couple of weeks. A 25-year-old male with a wife and new daughter. He was transitioning. He's transitioning the Army, transitioning out of the Army, and heading to Austin for his new life. And he came to see me with some toes 2 through 5 of his left foot with some. It's like a violation, sort of purplish hue, and it was swollen and painful. And I was like, "Ooh, that's not good. I really hope that is infection because I can treat it right away. Meanwhile, I'm going to be looking at other options." So I gave him a little bacitracin. I was like, "Come back right away if this, a day or two, if this isn't helping you." And meanwhile, I'll be looking into vascular surgery or hematology or who knows, maybe dermatology. And sure enough, he came back a couple days later, and it was worse. And now it's 2 through 5, toes 2 through 5 of his right foot as well as his left foot, and it was painful, purple. I was like, okay, this is clearly some micro thromboembolic situation here. It's definitely not infection. Somewhere on the differential would be like autoimmune something, vasculitis. Yeah, and so I got patient care coordinator, and we got him. We're like, well, we can't get him into consult right away, so let's get him to the ER, and they'll get him into a consult. So yep, they got him. They worked him up. They got him to a vascular surgeon. The vascular surgeon took one look at him and was like, "That's Buerger's disease." Buerger's disease was the last on my list. It is a diagnosis of exclusion. There's no test for it really, and it's kind of a catastrophic diagnosis. Your toes and fingers and limbs start falling off. It's a vasculitis, and it's more common in smokers, but it's not common at all. It's like 0.02% of the population. So the vascular surgeon walked into the appointment, according to the patient, took one look at his toes, is like, "Yep, that's Buerger's disease." And the patient, meanwhile, who's already anxious, he deals with anxiety, he came back to me and was freaking out. And I was like, "Listen, this is not Buerger's disease. I don't care what the vascular surgeon says. It's not Buerger's disease. We're going to take care of you. We will treat you, and you will lose no limbs, toes, fingers, anything on my watch." And he's like, "Oh, thank you. And by the way, I learned the other day that both of my brothers have factor 2 gene mutation, and they both have pulmonary embolisms." And I was like, "Well, I think we got a diagnosis." So I never ordered this particular genetic test. It's G20210 alpha. Never ordered it before. I ordered it. Came back positive. I was like, okay, we got a diagnosis. So by this time he had already seen a dermatologist who diagnosed him with a cold weather injury for his toes. That's not what it was. And I was like, it's not that either. It's not pernio, chilblains. It's not that. We were able to get him into a hematology consult, and he got a factor 10A inhibitor, Xarelto, rivaroxaban, low dose, and so he's doing a lot better now and feeling better. And I would just say, like, listen, even experts make mistakes, lunge at diagnoses. Doesn't mean you have to accept it. And sometimes, as a provider, the patient just tells me what they have, and I just run the test and treat it. So I'm not an expert on blood diseases, but shoot, the patient gave me his diagnosis himself, and he got treatment in spite of the best efforts of some of the people we sent him to. So hope today's going well. Just want to share that with you, sort of by way of a little video journal. Take care. See ya.